Hello, I'm Hunter Schultz, and this is Winning Healthcare Food Fights Without the Mess. Today, my guest is Kara Farley. She's a direct primary care patient at Southern Comfort Health in Fort Pierce, Florida. In our conversation, she mentioned something that brought back a memory, a good one. She mentioned how her doctor listens. And it reminded me of something that my dad used to say, and that is you take the word heart, drop the H, drop the T, and you're left with ear. There's a direct connection to that and more, starting right now. Kara Farley, thank you so much for joining me today.
You're welcome.
I'd love to ask you a quick question to start off, and that was, what was your care like before DPC?
So prior to having access to my doctor through DPC, I didn't have access to healthcare. So we didn't have insurance in my family, and healthcare was basically an emergent situation. If something was bad enough that you needed to go to the emergency room, that's when you got care. Otherwise, you looked it up online and hoped for the best. So
The roulette wheel of health.
yes.
So you went to the emergency room and urgent care and...
Sure, as needed, or just ignored symptoms and hoped for the best.
And then you waited for the bill.
Yes.
Oh, that can be kind of fun, right?
That's not fun at all.
What was one of the biggest benefits of direct primary care is the access to care, time to access. What was it like beforehand?
Most doctors don't want to see you on a cash pay basis. So trying to even schedule an appointment was non-existent. My husband and I both have experienced that, where it's just difficult to get help, and you find yourself going to the emergency room or an urgent care for something that wasn't as necessary because it's your only access to a doctor.
And what consumed your time the most in that system?
Trying to navigate yourself, because you don't have the same relationship with your doctor to believe what they're saying or to really feel like you're being heard as a patient.
And what did you do in order to augment the fact that you didn't have that hand holding? I can hear this one coming, but go ahead.
I don't think there's a lot you can do to make up for it. It's do a lot of searching on the internet and trying to figure out what you're going to do yourself, how you can do something over the counter, or what your symptoms might be, and stress, a whole lot of stress.
So as you're sitting in a doctor's office in the old system, what was that like? I mean, what consumed their time the most?
To be honest, I felt like most of my time was spent waiting. And any time that I've had to be at the doctor, their billing is their most important thing, and what they can put on a procedure code to make it worth your visit. And very little of it is spent with interaction with the doctor.
That had to have been frustrating.
It is incredibly frustrating.
So they were on the computer a lot.
Yes.
And that's got to be, we'll talk about the disconnection of care.
Right. You want to see your doctor and make eye contact and know that they're seeing you as another human in that room that matters.
Well, I think it's worth pointing out that for many doctors, it's the system that they're in that really, and I hear that a lot from doctors, so I think it's fair to point out, many of them are very frustrated because they know what's going on. And it hurts. It hurts. And a lot of physician suicides, by the way, are not because they want to die, it's because they want to end the pain. So ultimately, you switched to direct primary care.
I did.
What drove that? I mean, what drove that decision? And then what was it about DPC that you related to? So first, what drove that decision? Was it just over time you said, I got to get out of this, and you looked, or was it a specific event?
So for me, it was a specific event. It was something that was offered to me. So I got access to my doctor through my employer, and they were looking for a different model of care for their employees. And she offered this to me as an alternative to an increase in my salary. And I said, yes, I want to commit that money to my healthcare instead of my paycheck. So
Makes a big difference in your outlook, I'm sure.
it really does.
How do you feel about your care now?
It's wonderful. I've had multiple episodes of care this year. It's been a year for me in direct primary care. And I would say before that, that I was not a needy patient. Like I was relatively healthy in the last few years. I haven't had a lot of issues. And it's funny to see in the last year how many things I actually needed a doctor for. um, and having that access that saved me from having to go to the emergency room for a tetanus shot because I didn't have anyone else to say, yeah, you're going to need to get that because you got stabbed by a fishing hook. To things like stitches. I mean, just the amount of money that I've saved and the relationship where I was able to go in terrified because I'm a nervous person and know that my doctor respects where I'm at as a patient and could calmly interact with me was priceless.
Yeah, a big confidence booster for you.
Yes, absolutely.
And you spend your time 9 to 5 during the day teaching, or is that your primary job?
I am a mother of four, two of whom are homeschooled and two of whom are too young to homeschool. And
That's full
I
time
work,
and then some.
yes, it is. And then I also work from home, doing billing and care coordinating for a home birth midwifery practice.
Wow. Wow. Your hands are full and then some.
It's very busy. My life is very busy.
So, with all that going on, direct primary care must have an impact on managing that
Absolutely.
while managing your health care.
Yes,
Are there any
absolutely.
examples of how that works for you?
So for me, one of the biggest issues I had with care in the past is that my husband works full time, Monday through Friday, all hours that a doctor's office is open. And I don't have alternative childcare for my kids. They're not sitting in a school where I can go, oh, I'll go at 9:30 after I drop them off. So at my doctor's office now, I can bring them with me. There is a playroom they can stay in where I can access privacy with my doctor at the same time that I know my kids are safe. I'm not paying for a sitter or trying to find a friend who's not too busy for four more kids to add into her life. It's been freeing for me. I've also had access after hours when my husband was home where I could say, I'm going to go in at this time instead of going in when I have four kids by myself.
Kids make a big difference, don't they?
It's huge.
Did your care change during COVID?
My doctor sent consistent updates. We did do my 6-month well visit over Zoom. So that was a little bit different than usual, but that was a choice that I had. So I made that choice myself, but otherwise I've had the same access to my doctor that I had before.
I find that DPC docs are kind of they're shrugging off COVID-19 from a process standpoint because they've been
Sure.
doing telehealth and
Right.
chats, and it's not that big of a switch compared to the old system.
Yes.
Wow. Very early on, there were a few docs I saw on Twitter just, oh my God, I can't believe this telephone work.
Yes.
The DPC docs are going, hey, we're good. It's cool.
It works great.
And don't you want a doctor like that, frankly,
Yes,
who's happy?
absolutely.
And I mean, I've never met Dr. McCain, but I get the idea that she's pretty happy. She's good to,
Yes.
she's good to go.
She has been on top of it. I haven't noticed like a kink in the system where it was, oh my gosh, we've got to just reorganize and figure out what we're going to do. It's ran very smoothly for me as a patient.
What surprised you the most about direct primary care?
I think the biggest thing that I noticed different was at my first visit where she mirrored back to me something I had said, where I really knew I was being heard. I wasn't just there because she was the doctor that knows everything and I'm the lowly patient who is going to be told what to do. She mirrored back to me something that I found as a value in my healthcare. So I noticed that when you said this, that you probably don't want that. and I appreciated that I was respected as a person in my own beliefs for my healthcare.
That's a very powerful observation. Very powerful. It really is, because they have time to listen.
Yes.
And then if you take it a little more poetically and maybe philosophically, if you take the word heart, drop the H, drop the T, you have ear. They're able to
Yes.
listen with their hearts because they
Right.
care. They're very compassionate people. And that's part of the pain
Absolutely.
they feel in the old system, is they don't have that opportunity as much, if at all.
Yes, I agree.
So you're very lucky. I mean, lucky is probably not, you're very fortunate. Would you ever willingly go back to the old system?
No, I'm quite happy with the way that my care is now.
Hard stop.
Yeah, done. No way. I bill insurance companies for a living, and I see firsthand from the provider's office perspective that the system is broken, and this is a way that we can step out and take more control of our healthcare and get better results. So
Terrific. Cara, thanks again for joining me.
absolutely, thank you.
It's been a real pleasure. And I love what you said about the listening. That's so important. I know a lot of people will relate to that.
Yeah, thank you.
For Winning Healthcare Food Fights, I'm Hunter Schultz. Stay healthy, wash your hands a lot, and there you are.